Imagine watching your loved one slowly slip away, not just in memory, but in personality, transforming from a gentle soul into someone prone to angry outbursts, agitation, and even violence. This is the heartbreaking reality for many caregivers of dementia patients. As the disease progresses, it doesn't just erode cognitive abilities, it often brings unpredictable and confrontational behavior. To control this aggression, doctors frequently turn to medications like Seroquel, an antipsychotic drug. But is Seroquel the answer? This potent medication offers hope for some, but its use in dementia care is surrounded by controversy and risk. Seroquel, known generically as quetiapine, is primarily an antipsychotic medication. Initially developed and approved to treat schizophrenia and bipolar disorder, its primary function is to manage symptoms such as delusions, hallucinations, and extreme mood swings by targeting chemical imbalances in the brain. The key action of Seroquel is its ability to influence neurotransmitters, specifically dopamine and serotonin, two brain chemicals that play a significant role in mood regulation and perception. When a person experiences a psychotic episode, their brain essentially misfires, creating false perceptions or beliefs that don't align with reality. Seroquel helps restore some of this balance, reducing the intensity of these experiences. It acts as a dopamine antagonist, blocking excess dopamine in certain brain parts. Too much dopamine can lead to heightened agitation, delusions, or hallucinations. At the same time, Seroquel also influences serotonin receptors, which helps stabilize mood, reduce anxiety, and promote a sense of calm. However, beyond its approved uses for psychosis and mood disorders, Seroquel has found an off-label role in treating behavioral symptoms in dementia patients. Off-label use is a practice where doctors prescribe a medication for conditions other than originally approved. In the case of dementia, many patients suffer from aggression, anxiety, paranoia, or violent outbursts as their cognitive functions decline. These behaviors can be incredibly distressing for both the patient and caregivers, often making daily life unsafe or unmanageable. In such cases, doctors may prescribe Seroquel to manage these disruptive behaviors. By blocking dopamine and adjusting serotonin levels, Seroquel can help reduce agitation and aggression, providing a calming effect. This makes it easier for caregivers to manage the patient, potentially avoiding more drastic interventions like physical restraints or institutionalization. It's also thought to help with sleep disturbances common in dementia, adding another layer of benefit. Yet, while Seroquel may seem like a helpful tool in managing dementia-related behavior, it's not without controversy. The brain of a person with dementia is already in a fragile state, and altering neurotransmitters further comes with risks. Seroquel's sedative properties can make patients overly drowsy, increasing the risk of falls or reducing their quality of life. There's also an increased risk of serious side effects, such as strokes or heart issues in elderly patients. Thus, while Seroquel can be a lifeline for some, its use must be carefully weighed against potential risks. In the challenging world of dementia care, where a loved one's behavior can shift unpredictably from calm to aggressive in a matter of moments, Seroquel has proven to be a valuable tool for some families. For many caregivers, the daily battle isn't just about managing memory loss, but dealing with the anxiety, aggression, and violent outbursts that often accompany dementia. In such cases, Seroquel has shown significant benefits, providing much-needed relief for patients and their caregivers. One common scenario where Seroquel has been helpful is in managing sundowning, a term used to describe the agitation and confusion that worsens later in the day for many dementia patients. Caregivers often describe their loved ones becoming more aggressive, pacing, yelling, or striking out at others as evening approaches. This is a distressing and sometimes dangerous behavior to manage, particularly for family members trying to care for a loved one at home. In cases like this, Seroquel has provided a calming effect, reducing agitation and allowing the patient to feel more relaxed. As one caregiver shared, her husband, who suffered from Alzheimer's, became much more manageable after starting Seroquel in the evenings. His anxiety and aggression were reduced, allowing him to sit quietly and engage more positively with his surroundings. Another common benefit of Seroquel is seen in residential care settings, where dementia patients often struggle with interactions with other residents or staff. In these situations, patients may become confrontational, refusing help or reacting aggressively when approached for tasks like bathing, dressing, or eating. For staff and caregivers, these outbursts can lead to difficult situations that are hard to de-escalate. However, Seroquel has been reported to help reduce the frequency and intensity of aggressive behaviors in these cases. One caregiver recounted how her mother, who had been prone to yelling and hitting staff at her memory care facility, became calmer and less aggressive after being prescribed Seroquel. This made caregiving easier and improved the overall quality of life for her mother, who was less anxious and more comfortable in her surroundings. In home care, Seroquel has also been a game changer for many families trying to keep their loved ones out of nursing homes. For one caregiver, managing her father's aggressive outbursts became too overwhelming until his doctor prescribed Seroquel. After starting the medication, her father became more peaceful and less aggressive, allowing the family to keep him at home for longer. While Seroquel may not be the right solution for everyone, for many dementia patients and their caregivers, it offers a reprieve from the daily challenges of managing aggression and anxiety, creating a more peaceful and manageable care environment. While Seroquel has provided relief for many families dealing with the behavioral challenges of dementia, it's not without significant controversy and risks. For every story of success, there are concerns about the potential dangers this medication poses to elderly dementia patients. The most serious of these risks include an increased likelihood of stroke, heart attack, and even a higher mortality rate in elderly patients with dementia-related psychosis. The FDA has issued a black box warning, the most severe warning possible, advising against the use of antipsychotics like Seroquel in elderly dementia patients due to these risks. This stark warning forces caregivers and medical professionals to weigh the benefits of calming aggressive behavior against the potential for life-threatening side effects. Beyond the life-threatening risks, Seroquel can also cause a range of side effects that can negatively impact a patient's quality of life. One of the most common complaints is excessive drowsiness. Seroquel's soothing properties can leave patients feeling groggy or zoned out, which, while reducing aggression, also diminishes their ability to engage with their surroundings. Caregivers often report that their loved ones seem like different people on the medication, quieter and more manageable, but also less alert and present. This can be a difficult trade-off for patients who were once active or enjoyed some level of interaction. One caregiver shared how her mother, once feisty but still engaged in conversations, became lethargic and unresponsive after starting Seroquel. The family struggled with whether the calming effect was worth the loss of the mother's remaining spark. Another issue is that Seroquel doesn't always work as intended and can sometimes worsen the very symptoms it's meant to treat. Instead of calming a patient, some caregivers have reported increased agitation, confusion, or even new symptoms like tremors. In one case, a caregiver explained that after her father started Seroquel, his episodes of aggression worsened and he began pacing constantly, unable to rest. This unpredictability in how the drug affects individuals has led to divided opinions among caregivers and medical professionals. Some caregivers find Seroquel a lifeline, allowing them to manage difficult behaviors that would otherwise make home care impossible. Others, however, feel the risks and side effects outweigh any benefits, leaving them searching for alternative ways to manage aggression without compromising their loved one's health. The decision to use Seroquel ultimately becomes deeply personal, made in consultation with healthcare professionals, with each family weighing the pros and cons of their unique situation. When it comes to managing the challenging behaviors of dementia, many caregivers look beyond Seroquel, seeking alternative medications and non-pharmaceutical approaches. While Seroquel may be a common choice, other medications, such as Depakote and Ativan, are often considered in its place. Depakote, originally designed as an anti-seizure drug, has shown promise in helping manage aggression and agitation in dementia patients. Its mood-stabilizing properties can help calm patients without the severe risks associated with antipsychotics like Seroquel. Similarly, Ativan, an anti-anxiety medication, is sometimes prescribed to reduce agitation and anxiety. Ativan can be particularly useful for patients experiencing severe bouts of panic or restlessness, especially during the evening hours when behaviors tend to worsen, a phenomenon known as sundowning. However, medications alone are not always the ideal solution. For many families and caregivers, searching for a more natural and holistic approach leads them to non-pharmaceutical interventions. These strategies address the root causes of aggressive or anxious behavior rather than simply masking the symptoms. One critical approach is behavioral management, which involves observing what triggers a patient's aggression and learning how to diffuse it. For example, suppose a patient becomes agitated during certain tasks, such as bathing or dressing. In that case, caregivers can modify their approach using calming language or breaking the task into smaller, more manageable steps. Environmental adjustments can also play a big role in reducing agitation. Dementia patients often respond to their surroundings, and too much noise, confusion, or even harsh lighting can exacerbate their anxiety. Creating a calm, structured environment, using soft lighting, familiar objects, and limiting overstimulation can help prevent outbursts. In one case, a caregiver shared how simply dimming the lights and playing soft music in the evening dramatically reduced her husband's anxiety during sundowning episodes. Another essential non-pharmaceutical strategy is meeting the patient's basic needs. Sometimes, aggressive behavior is a way for a patient to communicate discomfort, such as pain, hunger, or the need to use the bathroom when they can no longer express these things verbally. Caregivers are encouraged to investigate possible physical causes of distress before turning to medication. For instance, if a dementia patient is consistently agitated at a particular time each day, it might be helpful to check whether they are uncomfortable or in pain, rather than immediately assuming their behavior is solely due to dementia. Finally, some caregivers find success using alternative therapies like aromatherapy, massage, or pet therapy, which can provide soothing comfort without the need for medication. These approaches may not work for every patient, but for those who respond well, they offer a safe and gentle way to manage difficult behaviors. In the end, finding the right balance between medication and non-pharmaceutical strategies often requires trial and error, patience, and close observation of the patient's needs. Each person with dementia is unique, and what works for one may not work for another. But combining these approaches can help improve the patient's quality of life and the caregiving experience. The decision to use Seroquel in dementia care is often fraught with emotional complexity. Caregivers are not only concerned about managing their loved one's aggression or anxiety, but also about the potential side effects that come with such powerful medications. For many, the thought of putting a loved one on a drug like Seroquel can feel like a double-edged sword. On the one hand, there is hope for relief from the outbursts and aggression that make daily care challenging. On the other, there's the fear of potential side effects, like grogginess, increased falls, or even more severe risks like stroke. One caregiver shared, "I was terrified to start my mom on Seroquel. I had read about the risks, and I didn't want her to be one of those patients who end up worse off because of the medication. but we were at a point where her aggression was unbearable. She was yelling, hitting, and refusing care. After trying everything else, I finally agreed to start her on a low dose. Honestly, it was like a night and day difference. She calmed down and became less anxious, and we finally had some peaceful moments together. I don't regret it for a second. For caregivers like this, the drug not only helps the patient, but also allows the caregiver to regain a sense of control and stability in their daily routine. However, not every experience is as positive. Some caregivers express regret over deciding to use the drug, particularly when it leads to serious side effects. One woman recounted her heartbreaking experience. When my dad started Seroquel, it was supposed to help with his violent outbursts. Instead, it made him drowsy all the time. He couldn't walk without help and kept falling. It got so bad that he broke his hip during one fall. I felt so guilty for agreeing to the medication. We ended up stopping it, but the damage was done. I wish I had listened to my gut and tried something else first. The emotional toll of making these decisions can be overwhelming for caregivers. They're constantly balancing their loved one's immediate needs with long-term risks. There's the fear of making the wrong choice, the guilt of seeing a loved one suffer, and the hope that the next treatment will be the right one. For many, it's not just about managing symptoms. It's about trying to do right by someone they love in the most difficult of circumstances. Dementia care is never one size fits all. Each patient's needs and responses to treatment are unique. What works wonders for one may have adverse effects on another. This makes it essential for caregivers to work closely with healthcare professionals, weighing the benefits and risks of medications like Seroquel. It's important to monitor for side effects and stay open to adjustments as needed. Combining medical treatments with non-drug interventions like behavioral techniques and environmental changes, a balanced approach can significantly improve a dementia patient's quality of life. Thoughtful, personalized care is key to ensuring both safety and well-being.